1. A patient is taking spironolactone and furosemide for heart failure. Which lab value should be monitored most closely? A. Sodium. B. Calcium. C. Potassium. D. Chloride. Answer: C. Potassium. Rationale: spironolactone is a potassium-sparing diuretic, while furosemide is a loop diuretic known for being potassium-wasting. Furosemide blocks sodium and chloride reabsorption in the loop of Henle, leading to significant potassium excretion, which could cause hypokalemia. Spironolactone, conversely, inhibits aldosterone in the distal tubules, retaining potassium to prevent the body's potassium from becoming dangerously low. When both are used, potassium levels can fluctuate unpredictably. Monitoring potassium is critical to avoid either hyperkalemia, too much potassium, or hypokalemia, too little, which can lead to life-threatening arrhythmias. 2. A nurse is administering digoxin to a patient with heart failure. Which electrolyte imbalance poses the greatest risk for digoxin toxicity? A. Hypocalcemia. B. Hypomagnesemia. C. Hyperkalemia. D. Hypokalemia. Answer: D. Hypokalemia. Rationale: hypokalemia is particularly concerning for patients on digoxin because low potassium levels increase the binding of digoxin to sodium-potassium ATPase in cardiac cells. This increased binding leads to an intensified effect of digoxin, which can result in toxicity. Symptoms of digoxin toxicity include nausea, vomiting, vision changes, e.g., seeing halos, and serious cardiac arrhythmias. Hyperkalemia would actually reduce the effects of digoxin, while hypomagnesemia and hypocalcemia have less impact on digoxin's mechanism of action compared to potassium. 3. When administering amiodarone, which side effect should the nurse prioritize monitoring? A. Pulmonary toxicity. B. Hepatotoxicity. C. Renal impairment. D. Photosensitivity. Answer: A. Pulmonary toxicity. Rationale: amiodarone, an antiarrhythmic, is well known for causing pulmonary toxicity, specifically interstitial pneumonitis, which can progress to life-threatening pulmonary fibrosis if untreated. This toxicity results from the accumulation of amiodarone in lung tissue, which damages alveolar cells. The drug's half-life is exceptionally long, and pulmonary toxicity may develop even months after initiation. Monitoring for symptoms like cough, dyspnea, and pulmonary infiltrates on imaging is essential. While amiodarone also affects the liver and skin, pulmonary toxicity poses the most immediate risk. 4. A patient taking atorvastatin complains of muscle pain. The nurse's priority assessment should be for A. Hepatic enzymes. B. Creatinine kinase, CK, levels. C. Blood urea nitrogen, BUN. D. Serum albumin. Answer: B. Creatinine kinase, CK, levels. Rationale: statins like atorvastatin can cause muscle damage, ranging from mild myalgia to severe rhabdomyolysis. Rhabdomyolysis involves the breakdown of muscle tissue, releasing muscle fibers into the bloodstream, which can lead to acute kidney failure. Elevated CK levels are a marker of muscle injury and indicate muscle breakdown. While statins can also increase liver enzymes, requiring hepatic monitoring, muscle pain and high CK levels are more indicative of statin-induced muscle damage. 5. A patient taking lithium reports nausea and tremors. Which of the following labs should be prioritized to rule out toxicity? A. Sodium levels. B. Lithium levels. C. Calcium levels. D. Creatinine levels. Answer: B. Lithium levels. Rationale: lithium has a narrow therapeutic index, meaning the difference between therapeutic and toxic doses is small. Early signs of toxicity include gastrointestinal symptoms, e.g., nausea, vomiting, and tremors. As toxicity progresses, symptoms may include confusion, ataxia, and seizures. Since lithium is primarily excreted by the kidneys, reduced renal function or dehydration can increase lithium levels. Sodium depletion can also increase lithium reabsorption, leading to toxicity, but confirming serum lithium levels is essential to assess hypertension is prescribed losartan. The nurse should educate the patient to avoid A. Dairy products. B. Bananas. C. Leafy greens. D. Citrus fruits. Answer: B. Bananas. Rationale: losartan, an angiotensin II receptor blocker, ARB, helps lower blood pressure but also has a mild potassium-sparing effect, which can lead to hyperkalemia. Potassium-rich foods like bananas can elevate potassium levels further, potentially causing dangerous arrhythmias or muscle weakness. Educating patients to limit high potassium foods helps mitigate this risk, especially when combining ARBs with other potassium-retaining medications. 7. When educating a patient on taking metformin, the nurse should instruct the patient to avoid A. Grapefruit juice. B. Foods high in fat. C. Alcohol. D. Leafy green vegetables. Answer: C. Alcohol. Rationale: metformin carries a rare but severe risk of lactic acidosis, especially in cases of renal impairment, liver dysfunction, or increased alcohol intake. Alcohol consumption increases the risk of lactic acidosis by raising lactate levels and impairing gluconeogenesis. Combining metformin with alcohol disrupts liver metabolism, increasing the production of lactic acid and putting patients at risk for acidosis, which can be fatal without prompt intervention. 8. A patient with asthma is prescribed both fluticasone and albuterol. Which instruction should the nurse prioritize? A. Take fluticasone first, followed by albuterol. B. Use albuterol only when short of breath. C. Take albuterol first, then fluticasone. D. Use fluticasone only if albuterol is ineffective. Answer: C. Take albuterol first, then fluticasone. Rationale: albuterol is a short-acting beta agonist, SABA, that quickly dilates airways, allowing greater penetration of inhaled corticosteroids like fluticasone. When taken first, albuterol opens airways, increasing the effectiveness of fluticasone, which works by reducing airway inflammation and preventing asthma exacerbations. If taken in reverse order, fluticasone would be less effective. 9. A patient taking warfarin is being educated about diet. Which of the following should the patient avoid to maintain stable INR levels? A. Grapefruit juice. B. Leafy green vegetables. C. Dairy products. D. High-protein foods. Answer: B. Leafy green vegetables. Rationale: warfarin works by inhibiting vitamin K-dependent clotting factors, so consuming leafy greens high in vitamin K, like spinach and kale, can reduce warfarin's effectiveness and lower the INR, putting patients at risk for clotting. A consistent intake of vitamin K is critical to maintaining stable INR levels, so patients are advised to either avoid or strictly limit vitamin K-rich foods. 10. When administering nitroglycerin for chest pain, the nurse should ensure which of the following assessments is completed. A. Respiratory rate. B. Heart rate. C. Blood pressure. D. Temperature. Answer: C. Blood pressure. Rationale: nitroglycerin is a vasodilator that significantly lowers blood pressure by reducing preload and afterload on the heart. A sudden drop in blood pressure can lead to syncope or shock, especially if administered repeatedly. Therefore, it is essential to assess blood pressure to ensure it is within a safe range before giving nitroglycerin. 11. A patient on heparin therapy has a PTT level significantly above the therapeutic range. Which medication should the nurse anticipate administering? A. Vitamin K. B. Protamine sulfate. C. Fresh frozen plasma. D. Platelet transfusion. Answer: B. Protamine sulfate. Rationale: heparin is an anticoagulant that enhances the activity of antithrombin, prolonging a PTT. When a PTT levels are too high, it suggests an increased bleeding risk. Protamine sulfate is the specific antidote for heparin overdose because it binds to heparin and neutralizes its effects within minutes. Vitamin K is the antidote for warfarin, not heparin, and fresh frozen plasma or platelets would not effectively counteract heparin's mechanism of action. Educating a patient taking levothyroxine. Which instruction is essential for proper medication absorption? A. Take with food to prevent GI upset. B. Take at night for best results. C. Avoid taking with calcium or iron supplements. D. Take with a glass of grapefruit juice. Answer: C. Avoid taking with calcium or iron supplements. Rationale: levothyroxine, a synthetic thyroid hormone, should be taken on an empty stomach to optimize absorption. Calcium and iron supplements interfere with its absorption by binding to the drug in the gastrointestinal tract, significantly reducing its effectiveness. Grapefruit juice can alter the metabolism of some medications, but it doesn't impact levothyroxine absorption directly. 13. A patient with a history of seizures is prescribed phenytoin. Which adverse effect requires immediate intervention? A. Gingival hyperplasia. B. Diplopia. C. Nystagmus. D. Slurred speech. Answer: D. Slurred speech. Rationale: while phenytoin commonly causes gingival hyperplasia, gum overgrowth, and may cause nystagmus and diplopia at higher levels, slurred speech suggests possible phenytoin toxicity. Phenytoin has a narrow therapeutic range, and toxicity can cause neurological symptoms such as ataxia, slurred speech, confusion, and, in severe cases, seizures. Monitoring blood levels is crucial to ensure the drug stays within a therapeutic range. 14. A nurse is preparing to administer a dose of vancomycin. Which assessment is crucial before administration? A. Heart rate. B. Blood pressure. C. Trough level. D. Respiratory rate. Answer: C. Trough level. Rationale: vancomycin requires therapeutic drug monitoring, especially a trough level measured just before the next dose. Monitoring the trough level ensures that vancomycin concentrations remain effective against bacteria while minimizing the risk of nephrotoxicity and ototoxicity. If trough levels are too high, it can lead to toxic effects on the kidneys and ears, while too low levels may be ineffective against infections. Blood pressure and other vitals are secondary to the priority of drug levels in this case. 15. A patient taking prednisone for an autoimmune condition is instructed to taper the dose before discontinuation. The rationale for this instruction is to prevent A. Hypotension. B. Adrenal insufficiency. C. Electrolyte imbalance. D. Immune suppression. Answer: B. Adrenal insufficiency. Rationale: prednisone is a corticosteroid that suppresses the hypothalamic pituitary adrenal (HPA) axis with long-term use. Abrupt discontinuation can lead to adrenal insufficiency, as the body's natural cortisol production may not be sufficient. Tapering the dose allows the adrenal glands to gradually resume their cortisol production, preventing symptoms such as severe fatigue, hypotension, and weakness that can accompany adrenal insufficiency. 16. A patient with type 1 diabetes has been prescribed regular insulin and glargine insulin. Which of the following is true regarding the administration of these insulins? A. Both can be administered in the same syringe. B. Administer glargine in the evening and regular before meals. C. Administer both insulins before meals. D. They have the same onset and duration. Answer: B. Administer glargine in the evening and regular before meals. Rationale: regular insulin is a short-acting insulin given before meals to manage postprandial blood glucose. Glargine, on the other hand, is a long-acting insulin meant to provide basal coverage and is usually administered once daily, often in the evening. They should not be mixed in the same syringe due to different pH levels, which would render glargine ineffective. Glargine has a prolonged onset and duration, while regular insulin has a quick onset and is receiving lithium for bipolar disorder. Which dietary advice is most appropriate? A. Increase sodium intake. B. Decrease sodium intake. C. Avoid caffeine entirely. D. Avoid foods high in potassium. Answer: A. Increase sodium intake. Rationale: lithium and sodium compete for reabsorption in the kidneys. A low sodium intake can lead to increased lithium reabsorption, potentially resulting in lithium toxicity. Maintaining a consistent sodium intake, or even slightly increasing it, can help avoid fluctuations in lithium levels. Although excessive caffeine may exacerbate lithium side effects, it's sodium levels that directly impact lithium concentration in the bloodstream. 18. A nurse is preparing to administer morphine to a postoperative patient. Which vital sign should be monitored most closely? A. Heart rate. B. Blood pressure. C. Respiratory rate. D. Temperature. Answer: C. Respiratory rate. Rationale: morphine is an opioid analgesic that suppresses the respiratory center in the brainstem, leading to a decreased respiratory rate, especially at higher doses or in opioid-naive patients. Respiratory depression can be life-threatening if left unmonitored. While morphine may also cause hypotension, monitoring respiratory rate is the highest priority. 19. A patient is prescribed nitrofurantoin for a urinary tract infection. Which side effect should prompt the nurse to contact the healthcare provider? A. Nausea. B. Dark-colored urine. C. Chest pain. D. Headache. Answer: C. Chest pain. Rationale: nitrofurantoin is generally well tolerated for treating urinary tract infections but can cause rare but serious pulmonary side effects, including interstitial pneumonitis or pulmonary fibrosis, manifesting as chest pain, cough, or shortness of breath. Nausea and dark-colored urine are common, harmless side effects, while chest pain may indicate a more severe reaction requiring immediate medical attention. 20. A nurse is teaching a patient about metoprolol. The patient should be instructed to report which of the following symptoms immediately. A. Dizziness when standing. B. Insomnia. C. Shortness of breath. D. Decreased appetite. Answer: C. Shortness of breath. Rationale: metoprolol is a beta blocker that reduces heart rate and contractility, lowering blood pressure and myocardial oxygen demand. However, it can also exacerbate bronchospasm in susceptible individuals, such as those with asthma or COPD. Shortness of breath could indicate bronchoconstriction, a serious adverse effect in patients with respiratory conditions. While dizziness can occur as a result of hypotension, shortness of breath is a more critical symptom that warrants immediate reporting.